KaziRa presents 3 ways to remove moles quickly. Using surgical treatments, using home remedies, and using medicated creams. Before that, please subscribe our channel and click the bell to turn on notifications to catch our next upload. Method 1. Using surgical treatments. Consult your doctor or dermatologist. You should have your mole examined by a doctor or dermatologist before you get it removed. They will be able to tell you whether your mole is malignant. They will also discuss what mole removal method is best for you. The vast majority of moles are benign. However, symptoms including itchiness, bleeding and changes in size or color may indicate that the mole is malignant. If a mole is malignant, it should be removed as soon as possible. If your mole is not dangerous, it may not be necessary to have it removed. However, many people prefer to have their moles removed for aesthetic reasons. Your doctor will use the ABD guide to assess your mole. This stands for asymmetry, border, color, diameter, and evolving. Weigh up your options. There are several methods of removing moles and you should carefully consider which method is best for you. You will need to think about effectiveness. Consider how effective each treatment is supposed to be. Will your chosen procedure remove the mole completely? Is there a risk that it could grow back? Cost. Different procedures will vary in terms of price, so think about what you can afford. Risk. What are the risks associated with each procedure? Can the mole become infected? Is there a risk of scarring or nerve damage? Will you need to be put under anesthetic? Consider removal using shaving. This type of removal works best for surface-level moles. The mole is shaved off with a scalpel. First, the surgeon will cut the mole away, so it no longer forms a bump on the skin. With this type of removal, stitches are unnecessary. The wound will be cauterized or covered in a cream or solution to stop the bleeding. Then a topical antibiotic will be applied. The wound will be bandaged up and you will be free to leave the office in a matter of minutes. Consider removal using an excision followed by stitches. This type of removal works best for moles that are darker in color or flat moles that penetrate deep within the skin. First, the mole and surrounding skin will be sterilized and numbed. Then, the surgeon uses a scalpel to cut out the mole. How deep of an incision needs to be made will depend on the size of the mole and whether or not it's malign. A wider area is usually cut away when the mole is malign, to ensure it is removed completely. The wound is then stitched closed. Some types of stitches require a follow-up appointment to be removed, while others will dissolve on their own. Consider removal using cryosurgery, or freezing. This is an alternate mole removal method which uses liquid nitrogen to freeze and destroy the mole. It is only offered by certain clinics. Also, keep in mind that cryotherapy freezes the tissue, so there would not be any tissue available to send a lab for testing and you would not be able to find out if the mole is cancerous. The liquid nitrogen can be applied to the mole directly using a cotton swab, or may be applied in the form of a spray. The liquid nitrogen may need to be applied several times to completely get rid of the mole. It will cause a blister to form on the skin, but once this heals, the skin should return to normal. This is KaziRa and you are watching 3 ways to remove moles quickly. Consider removal using electrocoagulation, or burning. Electrocoagulation burns the mole by shocking it with an electric current. This destroys the mole's tissue after several sessions. There is no need for stitches with this method, as the heat from the electricity cauterizes the wound. With this procedure, there would also be no tissue to send to a lab for cancer testing. Two other specialized mole removal methods offered by some clinics are radiosurgery, which uses radio frequency waves rather than electricity, and laser treatments. Both of these work on the same idea of burning the mole tissue away. Ask your doctor about electrosurgery. Electrosurgery may be a good option to discuss with your doctor. Using electrosurgery for mole removal can reduce any bleeding that may occur, and this in turn will reduce the risk of complications, promote rapid wound healing, and result in minimal scarring. Method 2. Using home remedies. Apply aloe vera. Aloe vera may be useful as a remedy for skin conditions, such as psoriasis, cold sores, burns, and frostbite. Applying aloe vera to your mole daily may help to get rid of it. To use aloe vera for mole removal, apply a generous amount of aloe vera to your mole, and then cover the mole with a clean cotton bandage. Leave the bandage on for 3 hours, and then remove it and wash away the aloe. Do this every day for 3 weeks and you may see results. Test out apple cider vinegar. Apple cider vinegar, a miracle ingredient used in countless home remedies, is one of the most common treatments for mole removal. The acids contained in the vinegar, such as malic and tartaric acid, actually work to dissolve the mole, completely removing it from the skin. Simply swab a little onto clean skin every day using a Q-tip. Know that garlic might be effective. Garlic is another multi-purpose remedy, which many claim as an effective treatment for mole removal. Simply crush some fresh garlic into a paste and carefully apply directly to the mole, making sure to avoid the surrounding skin. Garlic can burn. Cover with a bandage and leave for a few hours or overnight. This method has been said to work in as little as 5 days. Use iodine. Iodine is a good option for people with more sensitive skin, as it won't burn like garlic or apple cider vinegar. Apply the iodine directly to the mole using a Q-tip, up to 3 times a day. Continue to do this every day, until you see a noticeable improvement in the mole's appearance. Try sour apple juice. Juice a couple of sour cooking apples and apply a little juice directly to the mole. Like the apple cider vinegar, the acids in the juice will work to dissolve the mole, though it may be at least 3 weeks before you start to notice any improvements in the mole's appearance. This is KaziRa and you are watching 3 ways to remove moles quickly. Prep with pineapple and sea salt. Pineapple juice can be applied directly to the mole, but you should also try blending half a cup of fresh pineapple and a quarter cup of coarse sea salt to make a fantastic facial scrub. This may help to remove the top layers of skin from the mole. Test out castor oil and baking soda. Combine 1 tablespoon of baking soda and 2 tablespoons of castor oil, make a paste. Apply a little directly to your mole and leave for several hours or overnight, before washing off. Try using honey. Honey is well known as a delicious edible treat, but did you know it also boasts impressive antibacterial and healing properties? Dab a little honey directly onto the mole for a safe, natural treatment. Add in a drop of soothing, softening flaxseed oil too, if you like. Use home remedies responsibly. There are numerous home remedies designed to get rid of moles using natural ingredients. Though there is little science to back up some of the treatments, many people will attest to their effectiveness. Just be careful when using acidic natural juices, which have the potential to burn the skin. To use home remedies safely but effectively, apply the natural juices at least once in a maximum of 3 times a day. If you have very sensitive skin, only let the juices sit on your skin for 10 to 15 minutes, to prevent it from becoming irritated. Try applying a little petroleum jelly to the skin around the mole. This will prevent it from becoming unnecessarily irritated by the mole treatments. The length of time it takes for a mole to lighten or disappear will differ from one person to another. Be aware that home remedies are not likely to work as quickly or be as effective as surgical removal or stronger medical creams, but are a good option if you are looking for either a cost-free solution or a natural remedy. Method 3. Using medicated creams. Try using mole removal cream. Mole removal creams are an affordable and fairly effective method of removing moles at home. Most creams work by lightening the mole until it is no longer visible, which can happen in a matter of weeks. Stronger, over-the-counter creams focus on peeling the skin away layer by layer until the mole is removed. Keep in mind that mole removal creams can actually leave worse scars than surgical removal. Try out whitening cream. A general use whitening cream can also be effective at reducing the appearance of moles, but it will not actually remove the mole. A whitening cream will lighten the color of your mole, making it less obvious. Hope you all enjoyed this video. If you like this video, please subscribe, share and leave a comment for improvement. Thanks for watching.